From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And welcome to Medical Forum. We're on our fourth segment. I'm your host, Jeff Reed, and my co-host, Chris Markers. How are we doing today?
Good, Jeff. How you been?
Great. I think today is a very interesting segment for us because it's something near and dear to our heart. We're going to talk about At Your Service Home Care, who obviously is the lead sponsor for Medical Forum. And we also own it. So
Absolutely,
congratulations.
Jeff. Absolutely. New venture, Jeff.
Yeah. Well, let's give a little background. Not only do we host the show, my background is in the medical equipment field. Started Reliable Medical Equipment back in 1998. At Reliable, we deal with all durable medical equipment. We deal with respiratory. We deal with prosthetic limbs. So we've been instrumental, I hope, in the community here since 1998. And Chris, your background, just to remind everyone.
Yeah, I'm a family physician with Colonial Family Practice. I've been with Colonial Family Practice since 2007. I'm one of the partners in Colonial, and we've worked to grow Colonial to become a practice that offers a wide variety of services, ancillary services, urgent care, multi-specialty, and just to try to bring these type of expert physicians to the Sumter area and take care.
Yeah, it was great on segment 2 having Dr. Louder and yourself. So I appreciate you coming on the Medical Forum and enlightening us on that. But today, let's talk about At Your Service Home Care. And At Your Service Home Care, and we'll talk about how we came together about this, but it's they're on Wilson Hall Road, on 1250 Wilson Hall Road. It is a full-service home care company specializing, for the most part, in home care assistance, where we put attendants into the home, but it goes more than that. And I think that when we started, Chris, in my business and in your business, we saw that this was kind of a gap and a break in that care between the independent living to possibly having to go to a nursing facility. And I know that was something that you saw a lot in your practice.
Absolutely, Jeff. It's such a need. The population is aging at a tremendous rate. The new recipients of Medicare every day is growing exponentially. And oftentimes families are left with the need for additional services, benefits.
Well, that's one thing that we talked about with At Your Service Home Care is that obviously the gist of the business and the bulk of the business is coming into the house and keeping these people from what they don't want, which is a nursing facility. And sometimes that's the most appropriate, as you know. But we find that we're the link between the families and finding resources. In many cases, we find, and I think this is where we started our discussions, we find people that need legal assistance. They need medical equipment assistance. I know at Reliable Medical, when we drop off a hospital bed, when a patient's been discharged from the hospital, we know that this is not really a scenario that's going to last.
Jeff, a lot of these patients know what they need, but they don't know where to get it or how to get it, and oftentimes don't know how to fund it. And sometimes we provide information for needs that they didn't think they had. For instance, legal advice about living wills, trusts, things that have been already set up, maybe implemented, but they're not really sure how to address them in the future.
Well, and I think also additionally a need in the community. I sit on a committee with the hospital, and one of the biggest burdens on a hospital, not just in Sumter, but all hospitals, is the readmissions. And that is when a patient's been admitted into the hospital. We could take any diagnosis from COPD, congestive heart failure, what have you, and then they get discharged from the hospital, and they come home, and the caregivers, whether it be the parent, the husband, the siblings, what have you, all have the right ideas and the right thoughts, but then it just becomes such an overwhelming, and I hate to use the word burden, but that's what it becomes. And I think developing a company like At Your Service Home Care gives them, as we talk about, the link between not having to go to the nursing facility, not being discharged, and then be readmitting to the hospital. And I know you see that every day.
Jeff, again, that the readmission rate is something that all of the hospitals are battling. The patients oftentimes after discharge from the hospital don't need any highly technical care. They just need good, consistent care every day. And sometimes that just taxes the families. It taxes their ability to provide that consistent care every day. For instance, a patient who has heart failure needs to have a consistent diet, which might be low in salt, may need to be just weighed every day. And sometimes a simple weight can tell us if a patient is starting to have problems again. And those problems can be headed off, and hospital readmission can be averted simply by picking up on that change in weight.
Right.
And our attendants can do that. Our attendants can go in and they can weigh a patient daily if needed. They can provide journals, complete journals, check those weights, and if need be, notify the family members, perhaps notify the patient's family physician.
Well, I think that's one of the things that we talked about as we developed this company, was we want to do 3 or 4 things. Number one, we wanted to be very competitive price-wise, which we are. A lot of people look at it and is this going to cost me an arm and a leg? Is it very expensive? No, we're actually lower in a lot of costs from our competition, we'll call it other sitting services, and substantially lower than the alternative, which is the nursing home. And one thing that both opened our eyes to the dilemma was the fact that Medicare, after a rehabilitation for a nursing home, up to and could be less than 100 days, that becomes an expense. And I believe national studies show us for a single room, you could be $10,000 to $12,000 a month.
Absolutely, Jeff. When a patient is discharged from the hospital, Medicare pays for the first 20 days after hospitalization. And they only pay for those 20 days if the patient has very specific goals that can be met by that rehab facility. After 20 days, Medicare will pay 80% of the expense up to 100 days. But the patient is left with a 20% expense out of pocket, and that amounts to about $151 a day. So, again, the expenses are tremendous for skilled nursing facilities.
Well, and I think that's where At Your Service comes in. Not only, we're an alternative, as you mentioned to me many times, sometimes skilled nursing is the only alternative. We have what are called concierges in our business. And in our second segment, as we come up on a station break, we'll bring in 2 of our concierges to discuss what is a concierge. I'll give you total credit. That was your term and your idea. And it's a fantastic one. I think as we come up into our second segment after this break, we're going to learn a lot about what a concierge does and how they, along with our attendants that come into the house, help differentiate us from the market. So, At Your Service Home Care, thank you for presenting Medical Forum. Contact point, 1250 Wilson Hall Road in Sumter. Phone number, 803-607-9677. And we'll be right back after this first break.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
Owning a firearm is both a right and responsibility, and keeping your firearms out of the hands of criminals is a special concern. Last year, 38 guns were stolen from cars and homes in the city of Sumter. This is Joey Duggan reminding you to do your part as responsible gun owners. Help keep firearms out of the hands of criminals. Locking your vehicles in storage compartments if leaving a gun in your car, never leaving firearms in your vehicle overnight, and storing all firearms securely in your home. For additional information on firearm safety, contact the Sumter Police Department's Crime Prevention Unit at 436-2723.
As a referee, I pay attention for a living.
While I'm busy watching the game, I need your help keeping an eye on the stands.
If you see something that doesn't look quite right, tell a law enforcement official.
We all play an important role in protecting our communities, and you can help.
If you see something suspicious, say something to local authorities.
If you see something, say something is used with permission by the New York Metropolitan Transportation Authority.
This is Medical Forum, presented by At Your Service Home Care.
We're back with Medical Forum. Welcome back from our commercial break. I'm here with the host, Jeff Reed. I'm the co-host, Chris Marr. And we wanted to talk a little bit in this section about what a concierge is, in as far as At Your Service Home Care. We developed this thought with the idea of a hotel concierge, for instance. A hotel concierge will take care of you. You walk into the hotel from a place that you have not been before, you're not overly familiar with, and the concierge will take care of everything. They'll tell you where the local restaurant is. They'll get you tickets to the local play, tickets to the basketball game, tickets to the Clemson game if you're venturing out of town, or maybe the Gamecock game.
Yes.
But the concierge will take care of everything. And again, we really feel that a concierge takes you in and guides you through a realm that you're not overly familiar with. And so we adapted that idea of a concierge into our home care service. Oftentimes, home care for the elderly or anybody of any age who is ill and needs service. This is uncharted territory. This is an area that people have not been in before. They don't know how to access services, and they often have to do it very quickly. So we developed the idea of a concierge to help guide families in uncharted waters, to help with medical care, home service, meal planning, whatever we can do to be there, as well as provide comforts that the patient or client may really enjoy. So, without further ado, we have two of our concierge here today, Miss Christy Wainick and Miss Gina Marr, and we are going to talk a little bit about what concierge level service does at Your Service Home Care. And Christy, tell me a little bit about your perception of what we're doing and how effective it's been.
From my view, the concierge's role is to be the one and only person that a family or a client has to worry about contacting for any number of needs. We're basically the 411 or the information point for whatever they come across. If they need anything from just simple calls in the morning, if they need 24/7 care, we are there to line up the care based on what they need, and also to very specifically match the attendants and the assistants that come into their home, so we know that they are comfortable, they have more than just a babysitter. That's not what they've earned, and it's with respect and dignity to give them a single point of no matter what we need, no matter how small it seems or how large and how confusing it is, we are the only person that they need to contact, and then we bring in our resources. We give the guidance and the support that they often just want to have, to know that there's a secure place to go when they have questions.
Christy, you brought up a really interesting scenario, a call in the morning. This is a patient actually we have it's very interesting. A lot of people will think that the home care service may come in and have to provide hours and hours, and we'll do that. But this one patient's need was nothing more than a call in the morning. Tell me about that.
Correct. She is here. She has grown children and grandchildren that all live out of state, several hundreds of miles, and their concern was she just needs one person to make a call to in the morning, say, I'm up, I'm having a good day. If she needs milk, if she wants a hot meal dropped off, we'll handle that. But most importantly, if we don't hear from her by 10 or 10:30 at the mark point, then we make an attempt to call her. If we don't reach her, then we go to the house. And it's not something where we just send anybody we have available. It is her concierge. It is the person they have to make contact with. And if a problem is discovered, then we know to make the appropriate steps, whether it's contact her physician, contact one of her children, or even to call for medical emergency assistance. And it's that simple.
Jeff, I think this is a great situation, and I think it really shows how the patient had a need, the client had a need. It wasn't a tremendous need. It wasn't a large need. It was a very simple need, but
yes,
may have had a hard time finding that need met anywhere else.
Yeah, and we welcome people. We're right there on 1250 Wilson Hall Road, so very convenient. And we have people drop in all the time, and we'll talk about some of the cases that we've had. But it's very important for the listening audience to understand we're here not just, as you mentioned a minute ago, all of a sudden, Wednesday life is great. I've got 2 kids and we're going to the basketball game. Mom's doing fine, and I get a call at 3 a.m. saying she's not feeling good, and my whole life turns upside down. What we encourage people to do, stop by, call the office, sit down, the same way that you would go see an investment broker for your retirement, the same way that you would see to set up for college for your 2 kids and prepare for this. This is inevitable. If your mother's 83 or 73 or 71 or what have you, we sit down and we map out exactly what a plan of course of action for you can be, whether that is, all right, let's sit down with an attorney, let's sit down with long-term insurance. And a lot of these terms, power of attorney, directive of, those things don't make a lot of sense to people. Don't you find that, Christy? And the calls that you get sometimes are not just specifically about things that we do. It may be even about a ramp or something like that.
You're exactly correct, Jeff. And as Chris was saying, it's no need is too little, because the best thing people can do is start planning now. You don't want that emergency call in the middle of the night. Unfortunately, it does happen. But if you plan now, if you know who to call, if you're able to have them put you in touch with the expert resources for financial planning, elder law, we have attorneys here that we work with that specifically can help families walk through. They own their own homes. They've worked all their lives to build their homes in their lives, and that needs to be protected. And the best way to do that is to do it in advance of the sudden event or tragedy.
Yeah, we see that all the time. So I think as we come up on our second station break, we're saying to the people that are out there, this, for a lot of them, they come to us because we have an immediate problem, as Dr. Marr talked about. But what I think you're conveying back as a concierge, we get calls for people saying, I've got just some questions out here. Right. Hey, I'm 40 years old. My mom's 75, doing great, but wait a minute. What kind of steps should we take? And we're saying stop by 1250 Wilson Hall Road and see us. And we'll be right back after this brief message. Thank you.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment. For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we're back. Thank you for listening in on the show here on a Saturday, early Saturday morning, 10 to 11. And also want to remind everyone that this show also rebroadcast from 2 to 3 on Sunday. When we last left, we talked to our first concierge, Christy Wainick, and now we're going to bring in our second concierge that we have today, Gina Marr. Gina, how are we doing?
Good. How are you?
Give the listening audience just a little background on yourself, and we'll talk a little bit about being a concierge.
Well, my first job in life was a paramedic, and I started off with a degree in emergency health services, but as luck would have it, more need for money, so I became a corporate sales manager and then moved on to a financial planner, and now doing this so I can incorporate all of my trades together.
Those are great skills for a concierge. When we left the last segment, we were in a way talking about situations that could happen, and what I'd like to do on segment 3 is to talk about situations that have happened. Mm-hmm. So with your experience at Your Service Home Care, anything come to mind or just one that you want to talk about? And Christy, I would like for you then to come in and give us some of the stories that we've come across so our listening audience can say, yep, that's me. I feel that, or gosh, that could happen to me. So what's we'll call it a problem or a situation that you can recall happening?
Well, one of the things that I think is very interesting about our service is that we're a 24-hour care service. And for example, we had a call from one of our Alzheimer's patients' families who were very concerned a pipe broke in their house. It was a Sunday afternoon, and they were very concerned as to what to do. They called our concierge. They got together, made hotel arrangements for them, got an adjoining room for the caretaker, packed up some things, got arrangements for a cleaning service to come in and help them with that. And the family was just so grateful just to have someone to call. And basically all of those needs were taken care of, and it was very helpful for that Alzheimer's patient as well, who is familiar with the person that takes care of them to be moved to a different environment is very confusing, can be very frustrating for the family, and they were able to do that rather smoothly.
I think that's a huge need. At Reliable Medical Equipment, part of our service has always been the 24 on-call. We specifically, when we have an emergency, it's nothing like what you've described. It's usually we have a problem with oxygen or something that's life-threatening. Christy, relay maybe another situation that comes to mind that you would call.
Well, we had just recently a client who we had take care of at night, and at about 10 minutes to 12 one evening, I received the call, and she had to be taken to the hospital by ambulance, where she needed to get emergency care, and our attendant was with her the whole way, was in communication with her son, and was able to keep that constant for the client and relay information and be there to avoid as much disruption for her, and then be able to return home with her and get her settled back in and pick right back up where they had left off with as minimal disruption as possible.
In both of those situations, there's so many important components. Both of our attendants in those homes were spot on. The patient who had the bladder infection, the attendant was able to pick that up. The patient was able to be treated early to avoid hospitalization. So the attendants just did a fantastic job. But most home services, that's where it ends. You're getting an attendant. The attendant's going to try to make some phone calls and help things out. But with our service, you're getting that level, that concierge, that second person for the attendant to call and to really start mobilizing resources.
I think what Gina said is incredibly valuable in the fact that it's 24/7.
Absolutely.
So, we have Easter coming up tomorrow, and I hope everyone has a great Easter. But we will also be on call that day. And I know that we have clients because dementia and sickness and illness, as you know, forever, Dr. Moore, it doesn't take a day off. It doesn't take holidays off. So the fact that and we'll talk about our attendants coming up, how tremendous people they are. Not only are they educated, not only do they care, they sometimes, their life moves around and revolves around a dying individual. That you got to have a certain heart to do that. But there are no weekends for them as well. And I know, Christy, you might have a couple examples of, because I know last week you were doing a lot of schedule changing. As the concierge, we have people that will call us up, and it's kind of no different. I don't want to minimize it as setting reservations at the last second. Someone says, oh my goodness, it is Easter Sunday, and we want to go to the beach, or we want to go out to eat. We need 2 hours. We need 3 hours. We need 5 hours. And I know from some of your reactions, the thank yous that you get from our clients.
That is very true. It's our goal is, as a concierge and for the At Your Service Home Care, is we are there every step of the way. Once you become involved with us, even if you are out of town, if the family takes the client on a vacation, we are no longer involved. At any point that you need to make a change in the schedule, add anything, change the days, we're there to make the adjustment, because our goal is to make things run as smoothly as possible for the entire family and not just take care of the attendants and client interaction.
Well, I think that's great. As we come up on our station break, and we got about a minute and a half left, attendance, which is kind of the backbone of our company. Agree? As you as the concierge.
Absolutely.
So, Gina, tell us a little bit in this, as we close in on this segment, about the attendance. Some of the certifications, some of the specifications. What's a requirement to come to At Your Service Home Care if I'm listening out there looking for a position?
All of our attendants have to go through background checks and drug screening. But most of them have certifications in nursing home care facilities. They may be medical assistants. Some are we have some that are in college that are studying for their degrees and on the side are also working and taking care of things like that. But most of them have been in some sort of rehab facility or nursing facility in the past and are now doing this as a side or continuing to further their education.
Well, and Christy, talk to us about, because this is one of, I think, the staple of what Chris was talking about earlier with the concierge. And not only do we have a concierge service where we wear a jacket and dress nicely as the concierge. Tell us about the attendants and the attire that also comes into that.
All right. The attendants that are with our clients, they have a specific dress code. It's gray slacks, a white button shirt, and a navy blue blazer with our patch on it. And the reason we did that is so when they are out in public or at any event or outside the home with a client, the client doesn't have to feel like...
Kirsty, I'm going to interrupt you because we're going to come up on a station break, and if we don't get our dollars for our sponsors, we'll have to. We're going to come back with that right after this.
Medical Forum, presented by At Your Service Home Care.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And welcome back to Medical Forum, sponsored by At Your Service Home Care. And also today, our guest is At Your Service Home Care. And when we left the last segment, Christy, you were talking to us about the attire of not only the concierge, but the attendant. And we came up on a quick break there, so I had to cut you short. So I'd like for you to elaborate and maybe reiterate where you were.
The attire is the navy blazer with a crest patch, the gray slacks, and a white button shirt. And that is the view that we want all of our clients and the families to have of what we represent overall. The dignity and the respect that people have earned and deserve at any stage in their life. The last thing we want to do is have our clients going to family functions, going to the grocery store, going to church, going to any community event or just outside their home and feel like they are trailing around a babysitter or someone that represents an institutional type setting, and there's nothing wrong with that when it's necessary, and sometimes it is, but if we can give them the dignity of a gentleman's gentleman or a lady's maid there to see to their needs with as much in the background and not screaming, I can't take care of myself anymore.
Okay, and Gina, I think one of the things that I think is very different in what we do, we don't only treat the patient, we look at the whole scope. And then tell us about the matching process and how we find that perfect attendant or attendants in some people's case.
We sort of equate it to a dating service in that the concierge will sit down with the family, get to know the family, get to know the person that they're taking care of. You know, what kind of flowers do they like? What kind of music do they want to listen to? What sports teams do they like? The Gamecocks versus Clemson, things like that. We might ask important dates of the family, whose birthday is when, not just of the patient we're taking care of, but maybe the family members as well. Then we go back into our database and find the attendants that may also have the same similar interests, maybe in gardening or things like that. So there's a relationship that can be formed there. One of the interesting things, we had a client who had a dog who was very frightened when it came to lightning storms or fireworks, and the dog would be very agitated. And we needed someone who was able to go into the home as an attendant who was a dog lover, who didn't mind creating a dog or calming an animal. So there is a need for that match to take place. And we're sort of that love connection, if you will, between attendants and the clients.
Great. I think that's a great story. That client probably would not have been able to take that dog into an assisted living or a nursing home. Agreed?
Yes.
Agreed. And, pets are oftentimes part of the family. These pets have been with these people for years. And that was a great situation where, again, if we weren't providing that service, the alternative for that client may have been assisted living, nursing home, and would not have maintained the connection with their pet.
That sense of normalcy, right? In a chaotic situation. And, you brought up nursing homes, and I have nothing but respect for nursing homes. I really do. And I see that they are a much needed institutional facility. What we hope to do is be an alternative, because not all people in a nursing home need to be there. They just need to know that there are alternatives out there. And that's what I think we bring into play. And let's just talk us through a patient for a second. I mean, if we've got a patient that's gone through a traumatic episode that's landed them in the hospital. They may have gone from as independent as you or I to being now solely dependent. We've got a family that has gone from going and vacationing and planning events to now we've got an ailing parent or an ailing wife, ailing sibling. So we want them to still be able to live their lives. And I think, Gina, you hit a great note there. We're not only treating the patient, we're treating the caregiver, and we need to understand their obstacles. I have a good friend whose mother is very ill and found out that her brother, who they live together, also is very ill. And they're 30 years apart. And one of them was prepared for. We knew that individual was getting older. The one that kind of gets you is when someone 45, 50 takes on a terminal illness or needs treatments or needs assistance. And Christy, you run against that all the time.
That's very true. And that's one of the things that we have become very familiar with. It's when a family has a sudden event and they've made arrangements for that. They think they have that under control and things in place, and then suddenly they're hit with another complication, and from somebody needing to move, unexpectedly or someone else in the family taking ill. And what we try to do is bridge everything that they need to give support to the family so they don't feel burned out, and to the clients, no matter what their needs are, what their personalities are. We work very hard, as Gina said, to find a match. The assistant and attendant that's good for the lady in her 80s that grew up with the big band music certainly wasn't the proper choice for that lady's son in his 50s facing terminal cancer that rode motorcycles and grew up with bands in the 70s. So we take it very, very seriously on the very personal needs of each family overall.
Very good. And I think that's the key. And as we come to a little station break here in about a minute, I think talking about comparing what we do and the alternatives to nursing homes. And Dr. Marr, I know that one of the most animated you've ever been is when you met an individual who was describing his father about saying, I will not go to a nursing home.
Yeah, we all remember that.
Yes, I mean, you just don't see, I can't recall in my 15 years in the medical field, just dealing with the equipment and going to the homes and knowing that we're probably going to have a decision being made here when we deliver, say, a hospital bed with oxygen and a wheelchair and bathroom accessories, that there's going to have to be a tremendous burden taken on by the family to keep him at home, or nursing home's going to have to be an alternative, or a service like ours. And I think when we come back from our station break that we'll talk about comparing what we do from an expense standpoint, maybe give you some points of that you're not aware of on where Medicare starts and stops with helping these individuals. And then I'll finalize on how to contact us. So I appreciate everyone's time today. We'll come up on our last break here,
back
and we'll
with
be
the
right
latest
back
in health
after
and
this.
medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter, or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
This is Medical Forum, presented by At Your Service Home Care.
And welcome back to Medical Forum. We're here today with the host, Jeff Reed, myself, Chris Marr, two of our concierge, Christy Wainick and Gina Marr. And we are all with At Your Service Home Care, located on 1250 Wilson Hall Road. The phone number there is 803-607-9677. And in our last segment, we're going to just talk about, again, some of the alternatives that families have. One of the reasons that Jeff and I had talked about this company and the significant need for families and clients and patients to be cared for was that there's a large gap. There's a gap out there that is not met by hospitals, not met by certain insurance companies, not met by assisted living facilities, and not met by nursing homes. I see this in my office day in and day out, and it's very difficult trying to take care of a patient's medical needs, but again, I see these gaps trying to take care of all of their social needs, and the patient does not qualify to go into the hospital. The patient does not want to go to a nursing home. The patient wants to stay in their home. They want to stay in their home with their dog and their the food that they enjoy, their furniture they've had for 20 years. They want to stay in that environment. And there's so many reasons to keep them in that environment. Nursing homes, again, assisted living facilities are absolutely necessary in certain situations, but there are concerns there. The infection rates in institutional facilities are higher. A patient who comes into the hospital with pneumonia oftentimes has certain types of infections that aren't found outside of the institutional facilities, like assisted living, nursing home, or hospitals. In the home with our attendants, clients get continuity of care. They get the same 2 to 3 attendants coming in every day. They develop relationships with the attendants. The patient's needs are taken care of. And again, there's very little breach in that continuity. Patients tend to recover better in their own homes, whether they're recovering from surgeries or hip fractures, which can be very disruptive to patients' lives. After a patient suffers a hip fracture, we call it the rules of fours. 25% will continue to go on the way they were before their hip fracture. 25% will require a heightened level of skilled nursing or attendant care. 25% will end up in a skilled care facility, and 25% will die within a year as a result of the hip fracture. So again, that's just another scenario where there's alternatives. There's alternatives to skilled care. There's alternatives to assisted living. There's alternatives to leaving one's home.
And I think that another thing that we wanted to do, Chris, was make this service economical. And we have found that to stay in the home, as you mentioned, the couch, the backyard, the kitchen, the dog, the wife, the comfort of home, we can do it less expensive than we can a nursing home. And in most cases. So that's something that we're very proud of. But additionally, the concierge, which, again, Christy and Gina, thank you for coming here for the show. Your service, and correct me if I'm wrong, is of no cost to the patient. Is that correct, Christy?
That is absolutely correct. When we work with a family and a client, we perform our concierge role as their gift to them. And this is what we do. We bring in the people that then provide the services and base those fees on the level of care, the level of involvement that a family or a client needs. But what we do, we're there for them, and no, we don't charge for that.
So just so we understand, we have a package where this service of concierge attendant, setting up maybe a visit with an attorney, maybe setting up a doctor's appointment. You know, it's not always that you can see your doctor. That's one of the biggest problems, as we talked about with hospital discharges, is then getting back with the primary physician in a timely fashion. Some people don't have a reliable pharmacist. So we can bring all those in. And that's one thing that we want to really encourage the Sumter community, Clarendon as well, in Lee County, our surrounding listening area. We have great doctors here. We have great attorneys here. We have great medical staff. And I know, Gina, we talked about hospice and working in conjunction with the hospices and home health as we give that care. If you want to talk a little bit about how do we work with them, and I think there might be a slight confusion. Wait, if I'm on hospice, can I still have your care? Well, wait a minute, I'm getting home health. Are you guys home health? Give that explanation for the.
Well, I mean, I think one of the misconceptions is that once the patient or the person's on hospice, then the hospice takes care of them fully, and they do. They do a very good job, but there are some falls in there where they don't apply. For example, they may only come out to the house twice a day to check on things, but you might need a attendant there 24/7 just to help to make sure that mom doesn't fall out of bed or that mom's medications need to be given. So our service can come in and help do those things. We had one client whose hospice was going to help them with physical therapy. Well, their only service was to teach them what they may need to do, but they weren't going to come out every day to help initiate the therapy. So that was something that our attendants would do. They would get the directive from the doctor or the hospice and then do those physical things with the client.
Well, and I think also to let people know that if your loved one, your patient, sibling, what have you, is in an assisted living care, we also can sit with them as well. So it's not just in the home. If you've decided, we've gone on ahead, we've sold the house, or the mom doesn't want to keep up that garden in the backyard, and she is comfortable living at an assisted and wants to stay at that premium of price to be considered assisted living, we have the ability to bring our attendants in and keep her at that, which, as we all know, once you jump from assisted living cost to a full-skilled nursing cost, it's a tremendous expense.
Yes, it is. That there's a drastic difference between independent, assisted, and the skilled nursing.
Great. Chris, we're coming up on our final break. I hope you have a great Easter and your
you
family.
As well, Jeff, and you enjoy the Easter with your family.
Great. What we want to do is let everyone know, again, at your service home care on 1250 Wilson Hall Road. Phone number 803-607-9677. On the web, www.ays/homecare.com. Give a call. Talk with our abundance of concierge. And I want to thank Christy. I want to thank Gina for being here on our show today. Thank you, and everybody have a good Easter.
You too.